Welcome to our Facebook Live event at Reactive Physical Therapy. I'm Brittany Kim. I'm one of the physical therapists here.
And I'm Andrea Flores, and I'm a certified yoga therapist on staff here at Reactive.
Today we're going to be talking about how physical therapy and yoga therapy can work together to help you manage your chronic pain. And first, I just wanted to talk about what does chronic pain even mean? And typically, chronic pain is defined as pain that persists longer than normal tissue healing time, and usually that's about 3 months. However, I would say this definition doesn't really fit all of the conditions that fit into this definition of chronic pain. An example of that is complex regional pain syndrome. They fit into this definition of chronic pain, but they can actually be diagnosed days or even weeks after the original injury. And with chronic pain, at least my experience with my patients is it just really impacts your life, and it changes everything. And with that, there can be a really strong emotional toll. Mm-hmm.
Absolutely. And speaking from a yogic perspective, and not just a yogic perspective, but a human perspective, is that chronic pain does impact our lives, and some of us know it at different levels, from a very small, low scale to a much larger scale, which brings people here to Reactive. So basically, from a yogic perspective, we understand that we have these different layers. We have the emotional, we have the physical, obviously, the emotional layer. We have the intellectual layer, or our thought processes. We have the energetic layer, which is just, we all know what energy means, and then by extension we have the spiritual level, which just means our deeper core values and belief systems. So what does this mean with chronic pain? So we all know that we have experiences every day in our lives, and these experiences help shape our perception, and the perception can affect all of those other layers. It affects our emotions, it affects our thought processes. And so what that means is that if our pain can affect and shape those processes, what does that mean when we start experiencing our daily lives and how things can get hectic? And that can also affect how we experience our pain. So they're all connected, they're not separate.
And there's actually a really strong neurological basis for why this connection occurs. And a lot of the more recent research has been studying how the brain and the central nervous system plays a role in our pain experience. And in our brain, there's these different areas that are dedicated for different purposes. And so there's a part of our brain where we feel our emotions. There's a part of our brain where we think thoughts, right? Like, oh, that sweater is nice. Or if it's about pain, oh, I'm hurt. Like, what does that mean for my job? Like, am I going to be able to work? All these kind of thoughts come to our mind. And then there's a part of our brain where we actually feel different things. And one of those things can be pain. And it's this whole part of our brain that just is a giant map of our entire body, and so that we can feel all these different parts of our body. And all of these brain regions are very interconnected. They are physically connected, and when we have a pain experience, it joins them together even more. And when that experience happens repetitively, that bond between those areas becomes stronger, and to the point where, for example, you may have a fight with your spouse, and then all of a sudden you start having back pain, and you didn't do anything physically different, nothing changed, but just the fact that that part of your brain lit up, it also lit up this other part of your brain that is responsible for having you experience pain. And so that's kind of where I feel like yoga and physical therapy can work very well together, is like, how do we untangle this situation, and how do we work together to help you with your pain experience? Mm-hmm.
Well said. So yes, there's scientific support for all those crazy yogis over there in India have known for thousands of years, but we're still evolving, and so being able to understand that from a neurological and Western perspective is super important. The more we know, the more we learn, the better we are able to attend to and manage the times when the times get tough, basically, whether that's pain or anything else. So from a yogic perspective, yoga by nature is therapeutic, so we all know that, at least the people who have gone to yoga class, we always end up feeling better for the most part, in my understanding, in my experience. Yoga therapists can actually address your needs a little more specifically. So basically what we do is we like to assess, and part of that assessment is understanding what your story is, understanding what your experience is to pain, what your goals are, just who you are and what your response is to your life. And so all of that understanding helps us put together a program which could include meditation, it could include mindful techniques, breathing techniques, which is called pranayama, which is specifically about understanding the breath and the energy in our body, or actual asana, which is the postures and movements, and it can include all of those things. And that program means you would take this home and you would start to use it to help you incorporate in your daily life, and as almost like an intervention. So whenever you come across these things that may influence your pain or exacerbate it, you can use these tools on a regular basis to help you with that. So that's kind of what we do from a yoga therapeutic perspective, which is a very good support for physical therapy, and that's one of the reasons why it's part of this program that Brittany is going to tell you what that means. Yeah.
So for physical therapy, we're going to be using a lot of these tools that you will learn in yoga therapy, or that we might kind of explore very briefly together. And I find that the deep breathing and the mindfulness meditation is really important for helping people gain some control over their pain experience. And the deep breathing is really important because it helps basically turn down the volume of the pain by changing our nervous system, so that instead of being in this fight or flight mode, that we can kind of just calm down and relax. And that state is where people tend to have less pain, at least from my clinical experience. And we can use that tool for when we're trying to achieve our goals together. And my job is to help people get back to a better, more functional life, and hopefully with significantly less pain. And to do that, we use these tools along the way so that we can turn the volume down when we may have pushed things a little far, and to help us keep the nervous system in a better state so that it won't be so elevated all the time. And with the physical therapy approach, I want to help people get stronger. I want them to feel more confident in their bodies. I want them to remember how movement can be medicine, and that it's not harmful for our bodies. And so that's my main mission, primarily with my patients. And we just feel that when you are someone who has chronic pain, you really need a community of people that can support you. And it's just important, I think, for you to feel empowered and have resources to be able to manage your pain. And here at Re+active, we really focus on the person as a whole person, really looking at their whole story, really understanding what might be driving this pain experience, and trying to tailor your program to what's going to really meet your needs. I just think it's important because I think a lot of the time people with chronic pain walk around the medical community as just a condition rather than a person who has a face and a name and a story. Okay, so that's it for today's Facebook Live. Just remember to go to reactivept.com to sign up for our newsletter. Also follow us on Instagram at reactivept, and we're also on Facebook, obviously. So if you want, you can like us and follow us there as well. Thank you for listening and bearing with our technical difficulties.
Yes, thank you. We look forward to meeting you and working with you.